Before I start my formal statement, I'd really like Shani's friends to come up here and stand here and, just as a tribute to her and to these lifelong friendships that she'll have. Please join us up here. Really appreciate this. Anyway, good morning. My name is Jacqueline Gillan, and I am a board member of Citizens for Reliable and Safe Highways and have been involved with this organization for over 19 years. I am also Vice President of Advocates for Highway and Auto Safety. As you have heard before me, that every year we kill about 5,000 people in truck crashes. In the last 5 years, we've had over 25,000 people killed and 500,000 injured. And this morning, you've heard only 4 stories. Just think, this Mother's Day, how many mothers are going to receive sympathy cards instead of Mother's Day cards because they have lost a child in a truck crash? It is a public health crisis, and it's affecting every person in every community in every state across the country. That's why we've had truck crash victims, survivors, and their family members come to Washington, D.C. and spend today and tomorrow on Capitol Hill with their stories and their messages. And in sum, their message is, we've had enough. Political leaders would never, ever tolerate this many people dying in airline crashes. Yet year in and year out, the death and injury toll remains the same while the safety agenda is stalled in Congress or completely ignored at the Department of Transportation. And in fact, I would just edit Joan's remark about how we don't need a lapdog at the Department of Transportation overseeing truck safety. We don't need a lapdog, we need a bulldog. We need a bulldog to go in there and get the job done because this agenda has been languishing too long. This morning, truck safety advocates are releasing a ranking of the most dangerous states for truck crashes using the measure of truck crashes per 100,000 population. I'm sorry, if you want to stand right there. Here's the chart. We're also going to have it up on our website. And a lot of people ask, why are you choosing this health risk measure? Well, this is a health risk measure of looking at truck crashes per 100,000 population that's commonly used in the health community for assessing the prevalence of different diseases and trauma, including traffic crash trauma, as well as cancer, heart deaths and injuries. And we really thought this was an important measurement because usually the Department of Transportation looks at truck crash fatalities in terms of how many hundreds of millions of miles have been traveled. So what can happen using that measurement is deaths can go up, but if we have more trucks on the road traveling more miles, it makes it look like everything's fine. And is that really the measurement of what truck crashes are doing to our families? And this is the kind of statistic of looking at improvement based on more trucks traveling more miles the Department of Transportation has relied on and justified for not moving forward on a tough hours of service rule, on prohibiting bigger trucks, in requiring electronic onboard recorders. And it goes on and on and on. So that's the reason we took this measurement. And let me briefly list the top 20 states. We have number 1, Wyoming, number 2, Arkansas, and these are listed in terms of the danger, looking at truck crash fatalities as a factor of the population of that state. We have number 3 is Montana, number 4, Oklahoma, number 5, Alabama, number 6, New Mexico, number 7, Louisiana, number 8, Kansas, number 9, West Virginia, and number 10, Mississippi. So it doesn't matter what region of the country you're living in, truck crashes are killing too many people and we're not doing enough.